Hey everyone, this is Daily Dose of Medicine. Today we will talk about bed bugs, bites, causes, treatment, and prevention. But before we do that, let's talk shortly about it, the bed bugs. Adult bed bugs are small, flat, reddish brown insects. They are about the size of an apple seed and have an oval shaped body, as you can see here. After feeding, they become swollen and turn a reddish color like this. They are nocturnal, meaning they are most active at night. They feed on the blood of humans and animals, and they are attracted to the warmth and carbon dioxide emitted by their hosts. While they don't fly, they can move quickly across floors, walls, and ceilings. They prefer to hide in cracks and crevices close to their food source. Common hiding places include mattress seams, bed frames, headboards, and furniture. They are usually not dangerous, the bites, of course, but they can be itchy and uncomfortable. Let's talk about signs and symptoms of bed bug bites. We can see red and itchy bumps. They often appear as small red itchy bumps on the skin. They are typically arranged in a line or cluster. Swelling, the affected area may become swollen. Bed bug bites are known for causing intense itching. Scratching the bites can lead to secondary infection, which we will talk in the upcoming slides. Nocturnal pattern. They are nocturnal, so bites often occur while you are sleeping. Bites are commonly found on areas of the body that are exposed during sleep, such as the face, neck, arms, and hands. Yeah, we can see linear or clustered pattern. Bed bug bites may be in a linear pattern or grouped together in clusters. For treatment, please, before we talk about the treatment, avoid scratching. Although it can be tempting, try not to scratch to the bites to avoid infection. Keep your nails short to reduce the risk of breaking the skin. Topical treatments can be used over-the-counter anti-itch creams or lotions containing ingredients like hydrocortisone can help reduce itching and inflammation. But before you do anything, I recommend seeing a healthcare provider. Antihistamines, oral antihistamines such as diphenhydramine can also be used to relieve itching. Cold compress. Applying cold compress to the affected area can help reduce swelling and alleviate itching. Prescription medications can be used in severe cases. A doctor may prescribe stronger medications to relieve itching or treat an infection if one develops. So to prevent it, regularly inspect and clean sleeping areas. Use mattress and box spring encasements to reduce hiding spots. Be cautious when acquiring used furniture or items as they may harbor bed bugs. Be cautious when traveling. Inspect hotel rooms for signs of bed bugs before settling and avoid placing luggage on the bed or floor. If you suspect a bed bug infestation in your home, it's important to address it promptly. Consult with a pest control professional to help eliminate the infestation. Thank you so much for watching. Don't forget to subscribe to the channel. Don't forget to share this channel with your friends. And don't forget to join our channel membership. See you on the next one.